Assalamu alaikum warahmatullah. This short recording is about written tests. And in this talk, I'm going to start with an introduction to the types of assessment in general. And then I will be more specific, discussing assessment of knowledge. And then as part of the assessment of knowledge, I'm going to go into details of written tests. So what are the types of assessment? There is assessment of achievement, which is concerned with the assessment of knowledge and cognitive skills. Then the assessment of performance, which deals with the assessment of skills. And then assessment of attitudes, which is called the assessment of professionalism. So we have three types of assessment: one about knowledge, one the assessment of skills, and the last one is the assessment of attitudes. Now, what about assessment of achievement, which is the assessment of knowledge? This one can be assessed through different types of methods, assessment methods, or techniques, or using different instruments. And for example, it can be done during learning. So knowledge itself can be done, assessment of knowledge can be done during learning, like in seminars, tutorials, etc. So during learning, you can assess achievement. Then you can give students assignments, and then you score these assignments, and through those assignments, you can assess knowledge, the knowledge component, or the knowledge domain. Also, which is now not used frequently, is through oral examinations. And then we can include some assessment of knowledge using a spotter examination. It's a type of practical examination involving spotters that requires rotation of students through stations in batches. So they go through stations, and through that test, they can test their knowledge. And finally, assessment of achievement can be done using a written test, which is the topic of this recording. So what are written tests? What are the types of written tests? Now, written tests are classified as two types. The first type is called the selected response items. So in that written test, you use items and the students select the correct answer. For example, the MCQs, and MCQs are multiple choice questions. The term was used for a very specific type of questions. Then this type was classified into subcategories. Now MCQs is reserved for the single correct answer type. Then there is a multiple extended matching question type. It is similar to MCQs, but it is a bit extended. So we will go into details in another talk. And then there is the multiple response type. And in that type, the students or the candidate is expected to select more than one response. So the selected response items include MCQs, EMQs, and multiple response type. The second type is called the constructed response items. And in these items, there is a question, and based on that question, the student or the candidate is expected to construct a response. And this is why they are called the constructed response items. And they include the essays and modified essays, and the short notes or short answer questions. And these are various types to be described later on. And then there are the short answers questions. So there is a short notes, a short type of essay, and then we have the short answers question. The examiner asks a question and expects a series of short answers. So the selected ones are potentially more objective. And I think the definition of objectivity was described earlier. Now, the first type we mentioned is the multiple choice questions, and we will describe this in detail, but briefly speaking, this was historically used for items in which multiple responses can be selected, but then the term was reserved for for single correct answer rather than multiple responses, which are now known as multiple response items. The term is now reserved for the items in which only one response is selected, and it's called the type, the A type, the A type. Now, when you select an answer, which it can be a single one correct answer or single one best answer. So it can be a single or one correct answer or a single or one best answer. Some people call it single best answer. Some people call it one best answer. This is the type A, which is often called the best of 5 if you insist on using 5 options. You can call it the best of 5 type. So this is the multiple the MCQs. In the A type, the components of the A type, which we will discuss in detail later on. You have a stem, which is the largest part of the item, sufficient to answer the lead-in question. So you can have a stem. If it's a scenario, then it is called a vignette. And then you have a lead-in, which is a question being asked, which requires an answer. And then there is a number of options, the correct answer plus 3 to 5 distractors. So it's a list of options. One of them is the key answer or the correct answer, and then the remaining are called the distractors. Now, this is the structure. For example, the item this is an item. This is the totality is an item. The most populated capital of the world is, this one is the stem, and these are the options. This one is the key, and these are the distractors. The extended matching, on the other hand, it also has a stem and options. Both are extended. The stem is extended, and the options are extended. The items are organized. The item itself is organized into sets that use one list of options for all items in the set. So we have a set of questions, 3, 4, 5, any number, and then a list of options. And for all the items, we have this list of options to select from. A well-constructed extended matching set includes 4 components. They include a theme, an options list, a leading statement, and at least 2 item stems. And you can have 2 items or 3 or 4 or whatever. Now, this extended matching question, the arrangement of the components in it compared to the A-type MCQs is flipped. So in the MCQs, we have the item, the lead-in, then the options. But in the R-type of the extended matching question, only one response is selected. And in the pick N type, the other type, multiple responses are selected. So the R type, is similar to MCQs, but with an extended item, stem and extended list of options. While in the pick N type, which means pick a number of responses, there are multiple responses can be selected from the list. Now, a format in which there is one stem and a number of options, this format can be used. So there is a type in which there is only one stem and the number of option lists. So this is a modification of the extended matching question. The details of this will be discussed later on. Now, in the R type, the components include a theme. The theme, the lead-in, and the options are written first. So you put the theme at the top, the leading question then the list, then the stems are written last. So you can have the options, the correct answer, and a number of distractors. The lead-in, the question being asked, and the stem, which is the longest part of the item, sufficient to answer the lead-in question. This is just an example. For example, the theme of this question is fatigue. Then you have a list of options. Then you have a lead-in. For each patient with fatigue, select the most likely diagnosis. And then there is a stem, which is, in this case, is a scenario. So this is another list and a number of stems. This is called the pick N type, in which you have, for example, for the first stem, it is clearly written select for studies. So this is called the pick N type. Now the pick N type items, one stem and several options list. This is a different type of pick N. So you have a patient's history and the physical examination and all of that, one stem. Then you have different lists of options, and for each list you have a lead-in. For the patient whose chart is shown, select the condition for which he is at an increased risk. Select 4 conditions. Then for patients whose chart is shown, select the most appropriate health maintenance intervention, and so on. So this is good for the patient type scenarios in which you ask a number of questions followed by all the selection from different options. By the way, there are many books on this. For example, EMQs in clinical medicine, EMQs and MCQs and MQs in surgery, and so on. There are different books to help you pick from. Now, the last one of the selected response is the multiple response questions or items. And in this type, of course, very similar to the A type, the only difference is that when the candidate or the examinee select an answer, it selects more than one, and it should be specified the number to be selected, but it can be left, and then they will just go through the list and select the correct responses or answers. Now, it is similar to structure to the A type. Examinees select more than one option as being true and can be considered as a multiple true and false question, because each option the students need to determine whether it is true or false. Now, this can be improved if it is selection of the most appropriate options from a list of true options. So you have a list of true options, which are 5. Then we ask you to select the most appropriate 2 or 3 or whatever. This is a modification. For example, which of the following is the characteristic of a virus? And then the correct answers are A and D. It can cause disease. It lives in plant and animal cells. So these are the written tests, which are called the selected response items. Now, the constructed response items include essays and modified essays. The essays, of course, are quite subjective, and these include the short and the long essays. The essay can be short, it can be long. They are easy to construct, very easy. You can wake up in the morning and then write a very quick exam with a number of essay type questions, and that's it. It's not as difficult as the constructed response. But it opens the door widely for subjectivity and inter-rater and intra-rater variability. So, not highly recommended, but is still being used. And there is disagreement about the purpose, utility, and value. So there is disagreement between assessment experts and medical education experts. Now, advocates claim that essays improve writing ability, they give the students the chance to express their ideas, and so on. So they claim that they have certain pros. Now, when marked writing ability are rarely considered. This is the truth. They claim that it improves writing ability, but while they are marking or scoring it, they very rarely consider this writing ability. Now, there is a modification which is called the structured essay. So long essays can be made more objective by structuring it. This could be done by structuring the question and therefore structuring the answer. So write an essay about the facial nerve, its nuclei, course, distribution, and lesion. So I already structured it for the candidate, for the examinee. They can start writing by saying, well, the nuclei of the facial nerve are this and that, and then it moves from here to there, and so on. So it's a structured type of essay. It can be based on a clinical scenario, can also be used to structure the essay by dividing it into parts, each with a question requiring a short answer. So it's, instead of having it a long essay, it will be a long essay based on shorter essay type questions, and this will make a better type of essay. There is the modified essay question, the EMQ. It's not the EMQs. MEQs. AMQs are the extended massing, but these are the MEQs. And these MEQs, you have a patient scenario or clinical case scenario, but it is structured to structure the essay by dividing it into parts, and then the candidates are provided with the first part. Then this is collected after the answer it, and they are given the next part, and so on. So the structuring is called the modified essay question. Now, other parts are subsequently handed to the examinees, and now this is done through computers. The students is provided first with the part of the scenario they are asked to answer. Once they finish the answer, this part disappears, and the next part will appear, and so on. So it is now computer assisted. Now, the short notes, however, the candidates it's important to ask students to write about something. So, since long essays opens the door for subjectivity, short notes are a better choice. So they might be asked to write an explanation, an analysis, or a plan of action, something short, concise, and easily gradable. And this type of short notes address higher levels of learning. You don't ask them to write a short note about the nuclei of a cranial nerve. You ask them to write about something, or an analysis, or a plan, or something like that. Now, they, however, open the door for subjectivity and are difficult to mark, similar to long essays. Now, the better option of constructed response items are the short answer questions. Because they are structures, they are more objective, and these are more objective than essay and the essay type question. So candidates are required to provide short answers. This is why they are called multiple short answer questions, MSAs. So and the questions are structured in a way. This could use the question answer format, the fill in the blank format, or the multiple short answer format. So just a question and answer, or a part of a statement with gaps, and the students are asked to fill these gaps, or the student is asked a question and is expected to provide a multiple short answers. Now, efforts must be exerted to develop high quality items. They need some effort. So these are the constructed response items. Thank you very much.